You asked ChatGPT about your symptoms, and honestly, most of us have. It probably told you you're fine, and you wanted that so badly you actually put the phone down and went to sleep and never told anyone who could actually check you and verify that the information that you found is indeed correct and valid. Looking it up isn't ever the problem, and secretly, matter of fact, I'd encourage it, but keeping it to yourself, that's the part that can hurt you. I'm Florence, nurse practitioner. I've worked years in the ICU and home based medical care. And today I want to show you what's actually safe to ask AI about your health. More importantly, what you should never trust it to answer. Short version, it is safe, but how it's used, that changes everything. So stay with me and I'll explain. I want to be honest for a second. But I say it's okay that you research and use ChatGPT or Google or whatever AI. But the problem is when you're sitting in that exam room deciding whether to even mention it in the first place, because you're already probably picturing that eye roll. And so you swallow it. You think, I'm fine, it's just a checkup. And this is the part that honestly makes me sad and frustrated at times because care starts to fail right there when you hold yourself back like that. You did your part, you looked things up, to learn more about what your symptoms may be, but you didn't feel safe bringing it into the room. And I've watched this happen too many times. I've watched patients apologize for bringing in a list, and I've also watched someone wait 3 months because they don't want to look dramatic. And more often than not, I see folks who watch and wait end up going to the emergency room because now their symptoms have worsened. I want to ask you something. Have you ever left something off your list because you thought, that's probably nothing, or that sounds dumb? Yeah, that one. So here's what I'd tell my own loved one. It's safe to ask AI about your symptoms as long as you use it as preparation and not as a verdict or the final word. I want to say that one more time because it's really the whole point of this video, right? AI is a preparation tool and it's not a verdict. Asking it questions isn't dangerous, it's believing the answer and then skipping the person who can actually examine you. Here's something ChatGPT can't tell you because it simply doesn't know. Think about it. It's never met you, it can't feel your pulse, see your face, read your labs, or know the medications you've been on for 10 years. And at the end of the day, it's still just words on a screen. And the scarier part is that it can be confident and be completely wrong at the same time. In a voice, exactly assures when it's right. And that's not just my opinion. In one study, researchers asked medical questions, then asked how confident it was. Get this, it rated itself 90 to 100 out of 100, whether it was right or completely wrong. Its confidence actually told you nothing about whether it was correct. After all those years as a nurse in the ICU, I can honestly tell you I've never had someone wake up and say, I really wish I waited longer before getting checked. Not once, and not surprisingly, it's always the other way. Always. And sometimes that screen you're looking at can tell you you're probably fine when you're really not. When researchers compared an earlier ChatGPT against ER doctors, it actually steered people toward less urgent care than the doctors said they needed, about 41% of the time. That was an older model, and the newer ones are better, but the pattern still holds. Just let that sink in for a second. That's almost half the time the screen told someone to stay home when they actually needed to see a doctor. Let me paint you a picture for a second. I've put this together from a lot of different patients I've seen over the years. Let's call her Rosa. So she's in her 50s, and one day she stops halfway up her own stairs, winded, right? So she laughs it off, figures she's out of shape, and she actually apologizes to her husband for being lazy. That night, she goes to bed and she does what a lot of us would probably do. She researched by asking ChatGPT. And dependent on how she asked, it comes back gentle. It's probably your weight, probably your age, probably anxiety, probably fine. And so she waits about 3 months. Turns out her heart needed attention long before that. And by the way, women are more likely than men to delay getting heart symptoms checked because the signs don't always look like the movie version. Sometimes it's just winded on the stairs, tired, off. And nothing on that screen she was looking at could hear how hard she was breathing. In a second, I'm going to go over the 3 things to actually ask the AI so it preps you instead of spiraling you at midnight. And this can be so dangerous. Most people type like the one question that makes it all worse. So if AI can't be your doctor, let's make it useful. And here's where I see people get into trouble. That's probably the one prompt I wish people would stop using. What's wrong with me? Or even better, these versions I've seen. What do I have? What could this be? Can you diagnose me? Why do I feel like this? Should I be worried? Does this sound serious? Am I okay? It's that one question AI is worst at, and the one question that can potentially spiral you into a serious or worse off condition. So I want you to flip it. Don't ask it to diagnose you, ask it to prep you. So here's the three asks. One, help me describe this so my doctor understands it. Because, don't laugh, my body feels weird doesn't give as much to work with. But doing it right with AI is going to turn that into a dull ache below the ribs, worse after meals for 2 weeks. Do you see that difference? Now, that's something your provider can actually work with. Two, what questions should I ask my doctor about this? So now you walk into the exam room with a list and not a blank stare in the parking lot, right? Three, put what I told you into a clear timeline. So then what looks like a messy, scary week becomes one clean paragraph or list you hand over. So you see what happened? That's not playing doctor. That's doing your homework, preparing. So words, questions, timeline. Then you bring it to a human, your provider, who can actually examine you. And quick pro tip, you don't blurt out and lead with, so ChatGPT said I have such and such. Mm-mm. You lead with, so I did some reading to prepare and a few questions came up. See the difference? One starts an argument and the other starts a conversation. But how do you run that conversation without getting dismissed? Now, that's going to be its own video, and I'll point you to it at the end, so stay tuned. And listen, there's nothing in seeking understanding that you have to ever be ashamed of. Going looking for knowledge about your health has always been the wise thing. What we're really after isn't more information, it's peace. Not the kind from a screen telling you you're fine, it's the kind that comes from walking into that room prepared and walking out actually heard. So, next time you catch yourself typing symptoms into your phone, don't stop. In other words, just don't stop there. Use AI to get the words, the questions, maybe even organize your thoughts. Then bring all of that to someone who can actually examine you. And if there's one thing I want you to keep from this whole video, here it is. Your symptoms are real before anyone believes them. AI doesn't get the final say, neither does your fear. Your job was never to diagnose yourself. Your job is to notice your body, organize your thoughts, and bring the clues. That's it, and that's enough. That's what prepared patients do. And honestly, those are my favorite kind of patients to take care of because it improves communication and, in turn, that patient provider relationship. This channel is never here to replace your provider. It's actually here so you never walk into another appointment unprepared again. If that's the kind of patient you want to be, someone who walks in feeling prepared and confident instead of overwhelmed, I think you're going to love this community. I'd love to have you here, so subscribe and let's get you ready for the next one. I created a free AI prep sheet that walks you through these exact asks. Link is in the description. And carrying this into the room without getting ignored, that's the next video. So please subscribe and hit that notification so you can go watch it. I'm Florence, and I'll see you there.